Let me recognize the gentleman from Ohio, Dr. Wenstrup, to inquire.
Thank you, Mr. Chairman. Thank you all for being here today. This is a very important issue, very important to my district. I'm glad we're discussing substance abuse, mental health. The pandemic has fully exacerbated these conditions in my mind. The last hearing we had here in Ways and Means, I touched on a couple of stories. One about a veteran, a double amputee, and his last Facebook post was an empty refrigerator and a couple bottles of water, and then he took his life. I've shared a story about a gentleman from my district who was scheduled for his painful hernia to be operated on, and they canceled his surgery and he took his life. The isolation, the pain, the lack of treatment. A lot of lessons learned, I'd say, through this pandemic. And one of the other things that bothered me through this pandemic is when we told some people they weren't essential. I think that had a big impact on a lot of people to be told that, well, you're essential, we need you, we essentially don't need you. So we made a lot of mistakes. And in addition to the pandemic, the current border free-for-all is a part of this, and I'll get into that in more detail in a minute. And that empowered the cartels to go ahead and continue and exacerbate and grow their business, if you will, of human trafficking and drug trafficking. If you've read the book Dreamland, which I imagine most of you have, that's my district on the cover. So I know firsthand all the effects of what has been taking place. And I like to describe the problem that we have in America today with this is a problem that goes from our border all the way to work or purpose. So you do have a problem with the border with drugs coming across there. The supply chain is great. We should do what we can to stop that, everything that we can to stop that, and then stop the dealers that are running around our country. And then we have to take with our youth and everybody else and prevent people from ever getting in that situation. I'm a doctor, a surgeon. I never thought that those drugs were not addictive. I always felt that they were. I never prescribed OxyContin for my patients. And as a surgeon, I managed their pain in a lot of other ways and limited use of opioids. So there is an onus on the medical community too, and I think the medical community has responded to this. But we need to do more than just catch and release. When someone goes into rehab, that's a good thing, but there has to be something at the end of that. There has to be a purpose, there has to be a job, or else they're going to end up right where they are. So it's all encompassing of what we need to do to address these problems. And I'm grateful for the hard work of some of the folks in my district, like the Lindner Center of Hope and the Hamilton County Addiction Response Coalition. They've done some great work. 2018 passed Bipartisan Support Act, the Alto Bill, which is alternatives to opioids in the emergency department, and really throughout medicine is what we should be approaching. But I think at the end of the day, we need to always address the events and the issues in someone's life that led to the thoughts and the feelings that led to the behavior. And if we don't do that, we may never solve these issues. So as we try to be supportive of trying to solve these issues, you know, one question I would ask to Ms. Halsey, are there provisions in the Support Act that don't apply to fentanyl, for example, that we can update, or other things within that act that we can update to address some of the heightened challenges that we have today?
Yeah, absolutely. I think both CARA and the Support Act were such important pieces of legislation with new policy changes and resources to improve treatment, and support really helped us integrate treatment into the healthcare systems. Fentanyl, looking at different treatment options, making sure we have medication for opioid use disorder more widely available, making permanent some of our telehealth expansion pieces and the wraparound services that are needed. It's not just one thing that an individual in treatment and recovery from an opioid use disorder needs. They need wraparound care, and it's management of a chronic health condition. So looking at support and new vehicles to add more of that, I think would be a huge benefit to our patient population.
I appreciate that. As you heard me go through all those components that lead to the situation that we are in, that the patient is in, we do need more wraparound services. I appreciate the input, and I yield back.